And good afternoon where you are. It's a morning for us here in Canada, and thank you for having us present about our efforts and achievements at SusQI campus and AHS on our journey to promote sustainability in QI work, and specifically embedding SusQI framework within our AHS QI framework. We have seen some similarities with the work that Chris and Mary just talked about before the break. So we kind of all share very, very similar SusQI journeys. But just for context, I want to provide you some details about AHS in general and SusQI campus, which is the facility that I and Cassandra and Daniela come from. Alberta Health Services is one of the three entities within the Ministry of Health that delivers a broad range of healthcare on behalf of the government. And AHS serves population of over 4.5 million and over 100,000 staff, has over 100,000 staff. There is 106 acute care hospitals, and we have over 2 million emergency visits annually. AHS is organized into 5 geographic zones, South Calgary, Central Edmonton, and North, and we are in the Calgary zone. And the Calgary zone serves population of 1.6 million and has 14 hospitals, and you can see other details there. So we are in one of those 14 hospitals. We are at the SusQI campus hospital, and you can see the picture of our facility there. We have 323 hospital beds, about 70,000 emergency visits annually, and about 4,000 employees and 327 physicians. Our SusQI journey started in the summer of 2023 when a hospitalist physician, Dr. Gohol, learned about SusQI methodology and approached our hospital leadership and quality council to start the pilot at SusQI campus to implement the SusQI and current QI methodology. The proposal was accepted, and we secured the funding and started our journey on SusQI. And since then, we, like Rachel said, had a green team competition last year with 6 teams that included 11 staff and 4 physicians who participated and were trained to SusQI methodology. And you can see the annual savings there that were projected. So it's over 120,000 pounds and close to 7,200 miles. So we do use different units, but it's calculated in miles. We showcased the work of the Green Team competition in October of 2024, and presentations and posters were recorded and distributed for staff to see if they missed it. We have done a qualitative study to evaluate the Green Team competition, and findings are being analyzed. Right now, we are spreading and scaling the projects, selected projects, just in Calgary zone, but the goal is to scale and spread provincially. And like, again, Rachel said, we just started a 2025 Green Team competition, which is now expanded to Calgary zone with 7 teams. We are collaborating with Center of Sustainable Healthcare on a licensed competition approach. What that means is that we are leading facilitation with CSH support, and this is the first time that we are piloting this with CSH. You will hear about the winning project from the Green Team competition after this presentation, but I just want to highlight another achievement that we had, and that is that we became a SusQI Beacon site in August 2024. We are currently offering the SusQI workshop, which is a 3-hour-long virtual instructor-led interactive workshop. We are using MS Teams as a platform. We are offering regular and targeted group-specific sessions. We promote the event or the showcase, the workshop through Sustainability Community of Practice, which is the newly formed informal network for anyone who is interested in sustainability. It's formed in November 2024 and now has over 173 people on the mailing list. We have had 7 sessions since May 2024, and we trained 72 staff and 10 physicians. The key was the transition to virtual offering in January, where we have seen an increase in overall class size and attendance and geographic representation of the staff. So before it was only from Calgary zone, but now we are seeing a participation from across the province. We have developed a toolkit necessary to support training adoption as a result of feedback from staff that attended the training. And the tools that were developed for use are the SusQI impact template, metrics template, and medications carbon footprint calculator. We do have staff survey questions bank and list of AHS sustainability contacts. We are working on the units of healthcare calculator that we can also provide to staff who are trained. So crucial for our success in journey was the support from the senior leadership. And we also were able to connect the dots across the organization. We discovered that there are other teams that are championing sustainability in their own corners, and we connected with them to amplify each other's voice so that we can better advocate for change. And we are empowering trailblazers, and you will hear from them shortly. So the early adopters, the passionate driven individuals who are really keeping the momentum alive. And I just want to end with my personal note and reflection. How did it feel to be part of all this? So sometimes I felt overworked and occasionally I was frustrated, but in the end, it was deeply, deeply rewarding, as you can all attest. There is nothing quite like seeing your efforts ripple out and you being able to make a difference. So thank you so much. And I'll turn it over to the to Cassandra and Daniela.
My name is Cassandra Carrier. I am a registered nurse and quality improvement lead at South Health Campus Emergency Department. I'll let Daniela introduce herself and provide an introduction on our project.
Thank you, Cass, and thank you again for having us. It's really a privilege for us to be here today, able to present our project to you. I am Daniela Moreira. I am one of the unit managers, excuse me, here at South Health Campus Emergency Department in Alberta, Canada. And we will present to you today our Green Team winning project, which we are very proud about. And you can pass for the other slide, Cass, please. So, as of a background, it is estimated that medical supplies are responsible for almost 15% of carbon emissions related to the delivery of healthcare. And much of this footprint is attributed to their packaging and the administration technique. We know that some administration routes, for example, intravenous, require more single-use consumables and equipment than others, for example, oral. And variations to IV administration practice can also influence the consumables utilized and may sometimes unnecessarily increase cost, carbon emissions, and time of administration. So, for example, diluting a medication in a mini bag as opposed to giving directly IV. Our overall goal is to safely give medications as efficiently as possible. Therefore, this project aims to decrease resources required for IV administration of ketorolac at South Health Campus Emergency Department by engaging staff and changing the default order setting. In summary, we are encouraging IV direct administration here. Next slide, please. So what did we do and why did we choose that project? There were a few reasons why we chose this project. The first one is because the emergency department here at South Health Campus experienced an increase in mini bag ordering during the 2023 calendar year that we could have potentially linked to the implementation of a new charting system, electronic health records. And we know, based on previous research, that direct administration of IV medication decreases nursing workload, reduces time from order to administration, and results in significant cost savings. So what did we do? We checked the top 5 IV drugs ordered, and we decided that ketorolac would be the focus of this project because it was the 4th highest intravenous medication administered here at South Health Campus Emerge, and it can be safely given directly IV over 15 seconds. There was no significant impact to pharmacy's workflow. Our nurses were very familiar with this medication requiring minimal training or education, and there was great potential for replication. So our strategy was, in summary, think big, start small. It was a quick and easy implementation with minimal intervention.
So next, we completed a basic Ketorolac administration process map. Through process mapping, the Connect Care order. So Connect Care is our electronic healthcare record system. So if I refer to Connect Care, that's what I'm referring to as the electronic system that we utilized for orders and documentation. The order was identified as a driver of IV mini bag use. To the administration instructions indicating to administer in 50 milliliter mini bag. To reduce the use of mini bags for Ketorolac, the order in the electronic healthcare record was changed with the assistance of the pharmacy team to eliminate the verbiage indicating to administer in a mini bag. By eliminating mini bag use, additional steps associated with mini bag use, such as priming a line, finding a pole, cleaning the pole and the pump, connecting and disconnecting from the patient's IV, and wasting the materials were also reduced. Displayed in the process map is the eliminated steps in green. So this is the legend utilized to indicate the specific environmental, social, and financial impacts of each step. By eliminating steps in the process, a reduction of resources utilized or impact occurred for example, staff well-being, staff time, patient satisfaction, medical supplies, and waste disposal. So in addition to the Connect Care orders change, staff were encouraged to administer Ketorolac IV direct when applicable through the use of daily huddles in the emergency department and posters displaying the potential social, environmental, and financial savings. This is an example of one of 3 posters utilized. Change champions were also instrumental at driving the change in practice and providing guidance to staff regarding IV direct administration as needed.
Cass and Daniela, I'm really sorry to interrupt. We've got about 1 minute left.
Okay, I'll speed it up. Measurement of success for this project were evaluated through both qualitative and quantitative data, which was shared on our quality improvement boards. Projected annual financial and environmental savings are based on the number of Ketorolac orders monthly, with assumption that all previous orders were administered in a mini bag. Based on the number of monthly Ketorolac orders, our project's annual carbon emission saving from production, preparation, transportation, and disposal equated to about 1,271 kilograms. I did a bit of math for the UK group. That's about 3,000 miles. This is equivalent to driving 4,900 kilometers or driving from Vancouver and back twice. So the financial impacts of eliminating mini bag use for Ketorolac orders revealed projected savings of 23,000 Canadian dollars in medical supplies annually. This is equivalent to about 12,000 pounds. The impact to patients was evident in the first 30 days post-implementation, as an average time of Ketorolac order to administration time was noted to decrease 14%, and average ED physician assessment time to discharge time reduced by 6%. An unintended outcome was revealed, improving patient safety for medication administration, with a medication scanning compliance rate for Ketorolac increasing from 5.2% in April to 40.6% in June. ED patient testimonials revealed a negative perception of medical waste exists, as well as feelings of decreased mobility when IV lines and poles were utilized. This finding suggests reduction in IV line and pole use would increase patient satisfaction. By eliminating mini bag use, nursing time of approximately 292 hours annually was estimated. I'll turn it back over to Daniela for a conclusion of the project.
I will just wrap up. Thank you so much, Cass. So overall, this project just showed the significant impact of such a small change across different areas. We always say that this was just one medication in one department, one site. It is not really what the project was, but it's what the project can be and about all of the possibilities that it can encompass. So thank you so much again for having us.